Hi, I'm Dr. Siegmund from Chiropractic, and I'm here today to talk to you about a couple of the swing faults that I found out about when I went through my TPI certification out in Dallas that taught me about how to assess the golf swing properly. One of the first and most common things that we find in golfers is that they have what's called loss of posture. There are a lot of golfers that are out there that just try to swing too hard and they don't have the proper mechanics in order to get themselves into the best position possible. So the loss of posture essentially means that they're not able to maintain the posture over the ball, and then they tend to exaggerate their swing. So when you bring the golf club back, you should maintain a good neutral position to where you feel like you're centered over the ball. Far too often you'll find people that'll do this kind of motion, and they'll lean into the ball to try to hit it even harder, and then they lose what's called posture because I'm leaning in to the ball. The proper thing you should do is maintain a neutral position and even transition your weight into your back leg and come away from the ball where you're in a good position. That leads to less stress on the lower back, because when you have that loss of posture and you shorten up the whole side of your left side of your body, that leads to abnormal stresses on the lower back, because that's where all of your rotation is and all of the compression forces are when you lean into that side. So making sure that when you come back, you stay back up over the ball, you rotate into your right leg. That leads into the second most common problem that I see in golfers is what's called a sway. A sway or a slide. Now, sway means that you come too far away from the ball to make up for the lack of rotation you have into your shoulders. So when you slide backwards, you've already lost that normal position over the ball. Granted, you are elongating your left side, which is good for your swing, but you're further away from the ball now, and then to come into neutral, you do what's called, instead of a slide, you do what's called a sway. So you come into the ball, and look, I'm already past it, my body is already away from the ball, and then you block shots out to the right side. So those are two things you want to make sure that you keep track of. One, you don't lose posture, where you compress the left side. You lean away slightly, elongating the left side, and then make sure when you slide back, you're rotating with your right hip and pelvis and not with your whole body. And one thing you want to make sure that you're doing is also making sure that the ball itself is in a good position. There are a lot of people that tend to put the ball too far in the front of their stance or too far into the back. So make sure that if you have a club, such as me, with a 9-iron, that you position that in the middle of your stance, and then for each club length that you go up, whether it's an 8, 7-iron, all the way up to a driver, you're progressively moving that up half an inch towards the front of your left foot. So making sure that ball is not too far back. Granted, if you have to hit a lower shot, you can always position that ball a little bit further back just to keep the hood of the club down, but make sure that you're not losing that posture and doing what's called, as well as a reverse spine angle, which can compress the lower back and lead to back pain, but that you're not swaying either, and then losing the position to when you come down to the ball. So make sure that you get these done, otherwise it will cause you a good bit of lower back pain. And just so you know, we do check that out here in our office, and that way we can make your golf swing as efficient as it can be.